Good day and welcome to another National Emergency Operations Center COVID-19 weekly briefing for the 20th of April 2021. I am Les Roy Williams. Thank you very much for being a part of our briefing today. We continue to bring you updates, most recent updates, with respect to what is happening locally, regionally, and globally with the COVID-19 pandemic. The pandemic is still with us. As we can see that India is a reminder that the deadly COVID-19 is still wreaking havoc on countries. And it's a global effort. And when one country is in problems, we have to wet our house and so on. And that is just the case. We're all in it together. The world is moving on with vaccinations. And those who are not being vaccinated, the reality is that they will be left behind. There has always been the concept of the common good. In every discipline, whether it be science, whether it be philosophy, whether it be religion, sociology, the concept of the common good, the public good, has always been there. And that means that you want the greatest good for the greatest number of persons, a term that they call in philosophy utilitarianism. And what you don't want happening is that a few people are jeopardizing the common good or the public good, sometimes for their own selfish purposes. The same applies with the vaccination, the COVID-19 vaccination. Many people should get vaccinated as possible in order to promote and to protect the common good and the public good. I would invite Superintendent Cromwell Henry, member of the National COVID-19 Task Force, to give us his report.
A pleasant good afternoon, all, and thank you, Mr. Williams. Now, this afternoon, I did not prepare a speech as such, but I thought that as we approach the upcoming Labor holiday weekend, that I speak a bit on vaccine and highlight, sorry, not vaccine, on events, and highlight some of my experiences over the last weekend with respect to events. Now, on average, we see in the Federation 100 approved events per week. Most of these events are on the weekend generally, and we see a spike whenever there is a holiday weekend. And from observation in other countries, we see that whenever there is a spike in the virus, in the corona in these countries, it's usually after a celebration, a major event where large crowds gathers. And then shortly after that event, you have a spike, a surge in the number of cases. And we have a tendency here in the Federation to have crowded events on weekends, on holiday weekends in particular, without regard for protocols. And so we have a responsibility as law enforcement, as members of the task force, to remind persons of their responsibility so that they avoid these type of behavior. Now I just want to highlight 3 of my experiences in observing the events in the Federation, in St. Kitts, over last weekend. My first experience was with an event that was approved for Old Road, in Old Road. A daycare center had a barbecue, and they had permission to have hi-fi music with a DJ. Lo and behold, when we visited the event, there was a live band present in full operation. The permit for that event expressly restricted or prohibited live bands. Additionally, there were a 5-year-old at the entrance doing temperature checks for the patrons, a 5-year-old and a 10-year-old taking the names of persons attending. Of course, everybody just passed them straight and play with them and tap them on the head, and nothing was done that was supposed to be done. A total disregard for the protocols and the conditions that were set in that permit. The police stopped the ban and end the event, and the parents were not very happy. They were disrespectful to the police, as if it was the police who did something wrong and not them. So we want to bring these type of behavior to the attention of persons, that it is not acceptable. Persons must take responsibility when they do things that are wrong, and action is taken against them. There are consequences. My second experience was with a dance recital that got approval for 150 persons. When the event was visited, there were over 300 persons at that event. The organizers were spoken to, and criminal action is still being contemplated in that. The jury is still out on that one. We are seriously considering criminal action with respect to that particular event. And my final experience was with a live band that was in full operation at the food court at Rams camps. This band had no permission, absolutely no permission. They were hired by a bar at the establishment, and the owner thought that he had a right to have entertainment at his establishment, whether or not he had permission. Of course, the band was stopped, his operation was closed down, and he was given a severe warning. Now, I raise these 3 incidents to show what the compliance team and the police have to deal with week after week. That was just a sample of what goes on weekends in particular at these events. And we must realize that these protocols were established for our safety. They were not designed, they were not intended to suppress entertainment, to suppress people's enjoyment, but more so to protect people from the spread of the virus. We know the spread of the virus is facilitated by persons congregating in large crowds or crowded events. And so we try to prevent this by enforcing the protocols. A maximum of 100 persons are permitted for indoor events where the space permits it, and 150 persons for outdoor events. Social distancing, physical distancing is still required. The wearing of masks is still required. As we move into the phase now of vaccination, we will see some easing of these restrictions. We have already seen these easing of the restrictions have begun, and there will be further easing, but we still have to comply with the protocols until the restrictions are eased. And so we want to admonish persons, those of you who have not been vaccinated, to get vaccinated so that we could increase the pace of the easing of the restrictions. It is for your own good, it is for your own safety, and we encourage all to take their own health in their own hands. Thank you.
Thank you very much, Superintendent. I now invite our Chief Medical Officer, Dr. Hazel Laws, to update us on the Health Emergency Operations Center situation report.
Thank you, Mr. Williams, and a warm good afternoon to everyone. This afternoon, I will proceed in sharing with you the Health Emergency Operating Center Situation Report for Wednesday, April 28, 2021. To date, the Federation would have reported only 44 confirmed cases. All cases have recovered. So at present, we aren't following any positive persons. It's interesting to note that our last case was identified some 42 days ago, and so that's good. Between last year, January to present, over 147.5 million persons have been impacted by COVID-19, and over 3.1 million persons have died. But concurrently, vaccines, the COVID-19, have been rolled out globally, and to date, over 961.2 million doses have been administered already. In the United States of America, 32.2 million confirmed cases have been reported, and almost 575,000 deaths have occurred as a result of COVID. The infection, COVID-19, continue to impact the Caribbean region and the CARICOM member states. So the numbers continue to rise. So within CARICOM, amongst CARICOM member states, the islands would have reported over 156,000 cases and almost 2,600 deaths. Now, within the Organization of Eastern Caribbean States, meaning the 9 member states, over 11,800 confirmed cases were reported, and also approximately 161 deaths. But interestingly, I want us to pause and focus on Anguilla at this point in time. So our colleagues in Anguilla would have identified a cluster of cases 1 week ago, that's last week Wednesday, and between last Wednesday and yesterday, they would have identified 60 positive cases linked to this cluster. So as at yesterday, they would have identified 60 positive cases linked to this cluster. And so the total number of confirmed cases in Anguilla far exceeds 80, it's 80 something now as we speak, and rising. And it's alleged that the genesis of this cluster arose out of undocumented migrants who would have come into Anguilla from St. Martin. And so there's a lesson in that occurrence for us here in St. Kitts and Nevis. And I think as a federation, we need to acknowledge challenges, Sandy Point, and you see an unusual vessel pulling ashore. And if you see any strange faces in your community, it's your responsibility to call or reach out to the police and make an alert in this regard. St. Kitts and Nevis, we would have rolled out our COVID-19 vaccination program 9 weeks ago, and based on the figures just coming in this evening, we would have administered 12,432 COVID-19 vaccine doses, 12,432 doses. More specifically, 9,428 doses St. Kitts, 3,004 doses in Nevis. And so we would have covered 37.6 or 38% of the target population that we are catering to or focusing on. And by extension, we would have covered 26.3% of the total population with at least 1 dose of the Astrazeneca Oxford vaccine. So that's an update on our COVID-19 vaccination rollout or plan. We continue our surveillance on island. Anyone who presents in the emergency room, Alexandra Hospital, JNF Hospital, with COVID-like symptoms, you are swabbed, you're your sample is processed. So we continue testing. So to date, we would have tested over 13,000 persons so far, with a mere positivity rate of 0.3%. This just highlights the number of persons in any quarantine or vacation in place facility. We have 8 in home quarantine. They're utilizing the pre-approved home quarantine facility. To date, we would have released over 8,000 persons from quarantine, and so this figure represents what pertains between last year to present. So this afternoon, again, I'm going to just share additional information or recap general information regarding the Astrazeneca Oxford vaccine that we are offering to our citizens. So again, if you come on board, if you accept this vaccine, once you're fully vaccinated, you will enjoy an 83% risk reduction in picking up COVID. We are administering 2 doses, 8 to 10 weeks apart. And it provides you coverage against the emerging SARS-CoV-2 variants that have been identified, more specifically the UK variant. These are the common post-vaccine symptoms, non-specific symptoms that our people have explained or expressed. The mild fever and the aches and pains are relieved by acetaminophen or paracetamol. Coincidentally, this week we are celebrating Vaccination Week in the Americas, and so the Ministry of Health, Government of St. Kitts and Nevis, in collaboration with our CARICOM member states, Pan American Health Organization, World Health Organization, we are celebrating Vaccination Week in the Americas. It's a week when we focus on vaccines in general, vaccines on a whole. And the whole aim of this week of activities is to put the spotlight on vaccines, the value and importance of vaccines in terms of preventing infectious diseases, keeping them at bay, maintaining health, and bringing families closer. And so it's no surprise that this year's theme is, and I quote, "Vaccines bring us closer, #GetVax," end of quote. And so again, as I said, the spotlight this year is on the newest vaccines on the market, the COVID-19 vaccines. These vaccines are our best hope in ending this pandemic and rebuilding our local and regional economy. And it's interesting to note, just for information, that there is yet another vaccine on the market, and it's against a long-term infectious disease, malaria. And so we got news, I think last weekend, that this vaccine has come to the fore with a 70-something% efficacy. And so that's the latest kid on the block in terms of vaccines, a vaccine against malaria. Now, what are the benefits and value of the Astrazeneca Oxford vaccine? So many persons who have not yet consented to receiving this vaccine, they ask this question: tell me why I should take this vaccine. What are the benefits? And so one, it's approved by the World Health Organization, and so that's good. Two, it's effective. And so this vaccine is effective in reducing your risk at contracting SARS-CoV-2 or COVID-19. It reduces your risk by as much as 83% once you receive 2 doses, 8 to 12 weeks apart. It's effective in preventing severe COVID. It's effective in preventing death. Thirdly, this vaccine works well in older adults. The results from recent studies confirm a vaccine efficacy of as high as 85% in persons who are over 65. Again, given once they would have received 2 doses, 4, 8 to 12 weeks apart. So it's approved by the WHO, it's effective, it works well in older adults. This vaccine also provides protection against the emerging SARS-CoV-2 variants, particularly the UK variant. So the studies or the latest scientific data tell us that there is high efficacy against the UK variant, and it also provides some protection against the variant identified in South Africa and Brazil. As a matter of fact, the scientific literature suggests that most of the COVID-19 vaccine candidates provide some protection against most of the variants that are emerging and of public health concern. Number 5, the latest scientific information suggests that the Astrazeneca Oxford vaccine reduces the transmission of SARS-CoV-2 virus. However, more data is required to determine the true extent of this reduction. So in other words, if you are fully vaccinated, let me just pause. Somebody is deemed to be fully vaccinated if you would have received the 2 doses of the Astrazeneca vaccine and 2 weeks would have elapsed. And if you are in the US and you receive the 1 dose of the Johnson & Johnson vaccine and 2 weeks would have elapsed, then you would be deemed fully vaccinated. So if you are fully vaccinated from the Astrazeneca Oxford vaccine, the vaccine provides you a reduced risk, or there's a reduction in the risk of your picking up the virus, and if perchance you do, there is a reduction in the risk of your being able to transmit the virus to another individual. And so that's important, and that's the bit of information we were awaiting for months. And so we are happy to learn this, and more scientific work is being done in this area in order to inform us as to the true extent of this reduction. Please note that this vaccine has a wide global reach, and just recently, through the COVAX facility, some 142 countries have received and continue to receive millions of doses of this AstraZeneca Oxford vaccine. So ladies and gentlemen, there are innumerable benefits from taking or coming on board in terms of accepting this vaccine. And so last evening, we, on Leadership Matters, the Honorable Prime Minister, Dr. Timothy Harris, would have announced some policy changes. And so this afternoon, I'm going to try and summarize these policy changes, or changes to our existing health and travel protocols that have been governing the Federation, or the operations in the Federation, over the past 5 to 6 months. 1, he announced a reduction in the quarantine time for inbound air travelers who are fully vaccinated with the following COVID-19 vaccines: 1, Pfizer-BioNTech vaccine, Moderna, AstraZeneca Oxford, and Janssen-Silags Johnson & Johnson. So if we have an inbound air traveler fully vaccinated with either of these, so in other words, 2 doses of the Pfizer-BioNTech, 2 doses of Moderna, 2 doses of the AstraZeneca Oxford, or 1 dose of the Janssen-Silags Johnson & Johnson, and 2 weeks would have elapsed before your travel date, then the individual would be deemed fully vaccinated. And so if you find yourself in this category, there will be a reduction in your quarantine period upon arrival into the Federation of St. Kitts and Nevis. There are some other requirements for such individuals. So fully vaccinated individuals would still have to provide us a negative pre-arrival RT-PCR test done within 3 days of travel to the Federation. Fully vaccinated inbound passenger may be tested on arrival at RLB or at the Vaccination Airport if the pre-arrival test is outdated or if it is not acceptable. You will still be asked to complete the entry form on knatravelform.kn, and then you will be transferred from the airport to your quarantine or vacation and the individual can be officially released from quarantine if a negative RT-PCR test is returned on day number 9 of quarantine. So your sample will be taken on day 9 and your results would be returned thereafter. So upon receipt of a negative RT-PCR test, you will be officially released from quarantine. A pre-departure test is not required by the Federation at this time. However, please note that our requirements in this regard may change if we identify any cluster of COVID-19 cases or community transmission. However, please note that a pre-departure test may still be required if the country of destination requires it. So, if you are fully vaccinated and you are leaving the Federation, going back to the US or the UK, Canada, or further afield, if the country of destination requires a pre-arrival test, you will have to do a pre-departure test for that purpose. Number 2, the Prime Minister would have announced that fully vaccinated spectators would be able to access venues of amateur and recreational sporting events effective May 20, 2021. However, the following requirements must be adhered to. Spectators must maintain hand hygiene. Spectators, meaning the fully vaccinated spectators, must wear a face mask, and you must adhere to the requirement of 50% spectator capacity, and the organizers should maintain or must maintain a registry of names and contact information of all the fully vaccinated spectators who are admitted to the venues, along with temperature checks. Please note that the fully vaccinated amateur and recreational sporting event organizers must first seek approval from Ministry of Sports and the Commissioner of Police. The Prime Minister also announced that favorable consideration would be granted to fully vaccinated cultural and entertainment events, whereby only fully vaccinated patrons are allowed entrance. The recommended start date is July 19th, 2021. However, again, the following requirements must be adhered to. Fully vaccinated patrons must maintain hand hygiene. There would be temperature checks at the entrance of the event. The patrons would be required to wear a face mask, and the organizers would be required to maintain a registry of names and contact information of patrons, and there should be adherence to the 50% patron capacity. Now, all event operators, event staff, and entertainers must be fully vaccinated. Please note that the organizers of these fully vaccinated events must first seek approval from Commissioner of Police. Please note that there would be mixed cultural events still taking place in the Federation. When I say mixed, I'm referring to an event that will be catering to vaccinated and non-vaccinated patrons. These events must adhere to existing protocols. Weddings, funerals, and church services are considered mixed events, whereby there would be vaccinated and non-vaccinated persons in attendance. Again, these events would be in adherence to the existing protocols. Please note that these recommended policy changes can be amended immediately if our local COVID-19 status changes. Ladies and gentlemen, it's still the goal of the Federation to attain the 70% herd immunity threshold, whereby 70% of our population should be vaccinated. And we are hoping to achieve this by September of this year. this is just a reminder of the essential public health actions that we have to continue and maintain in order to keep safe. We need to learn the lessons from our sister island, Anguilla. Protect yourself. I am protecting myself against COVID-19 through vaccination. Hashtag vaccines work. Hashtag do not wait, vaccinate. I thank you.
Thank you very much, Dr. Laws. That brings us to our question and answer segment. I only have one question. Can a child be vaxxed if he or she needs to travel with their parents, especially since if parents are vaxxed upon return, the child will not be eligible for 9 days quarantine. So both would have to quarantine for 14 days. Dr. Laws.
Leslie, I think you answered the question. Basically, yes, because for now, children, for example, the Oxford Astrazeneca vaccine can only be given to individuals over 18 years, so adults, young adults, and older. The Pfizer-BioNTech, I think, can be given to persons 16 years and over. And so if you have a child, if you're traveling with a child below the age of 16, they would not be vaccinated, and so won't be eligible for this reduction in quarantine time or period, because we really don't want to start off with waivers and exceptions, because we really need to adhere to what we would have put in place, because there are still risks, attendant risks. The vaccine provides you a reduced risk in picking up the infection. You could have picked it up during travel, and then we still have to bear in mind that there are variants, and that's the variants are complicating the whole situation, and so we have to monitor our risk and be very careful. Thank you.
Thank you very much, Dr. Laws. I was amazed when I saw the long lines in Anguilla with people lining up to be vaccinated. And that came after the cluster was discovered, and following that, numerous positive cases of COVID-19. We don't have to wait for that here, for people to rush to get a vaccine. We cannot continue to tempt fate. We cannot continue to tempt fate, because as much as we have had success in the management of the COVID-19 pandemic here in the Federation, we cannot be lulled into a false sense of complacency that somehow we are bionic, that somehow we are invincible, that somehow we are immune. We are a part of the world. And because other places are still having a resurgence of the virus in places like India and some other places, it simply means that we are still at risk. And that is what people need to understand. We are at risk. We do not live all by ourselves on another planet. We're on the same planet, planet Earth. I want to thank all of you for joining us today for our COVID-19 briefing. Of course, it is extremely important that you continue to listen to the authorities on the subject of the COVID-19 virus. We have very competent doctors in this federation, and we have competent doctors all around the world. It was the best of scientists that came together to develop this COVID-19 vaccine. The best scientific minds in the world that came together. And yet, some of us are refusing to believe in the science. Before, we never questioned whether a vaccine was Pfizer, whether it was Astrazeneca, whether it was Novavax, or whether it was Sputnik, or whether it was Johnson & Johnson. We took the vaccines. But now there's a lot of questioning and so on. I suppose because it's a new virus, we've never lived through a pandemic before, because the last one was in 1918. But however, we have to trust, and we have to believe in the science that is really not leading us astray. Just the way that we believe in technology. We believe in our cell phones and our computers, the same cell phones that's bringing us the fake news, and so on, and the same cell phones that is bringing us as well accurate news and timely news and so on. We have to believe in the science, because science and technology basically go hand in hand. Thank you very much, Dr. Wilkinson, Cameron Wilkinson, the Medical Chief of Staff at the Joseph N. France Hospital, who continues to be dedicated to this cause, and Dr. Hazel Laws, our Chief Medical Officer as well. Superintendent Cromwell Henry as well, Mr. Abdius Samuel, our National Disaster Coordinator and the Chair of the National COVID-19 Task Force, Mrs. Christmas Jacobs, who continues to dedicate her time of providing sign language for an important group in our population and further afield, because this briefing goes all over the world. And ZIZ for continuing to be here and dedicated, Colin and John James and all the media houses in the Federation who continue to partner in this fight against the COVID-19 pandemic, with providing, of course, accurate information, not creating and adding to the fake news and creating to alarm and spreading things that are extremely scandalous and not true. We rely on your good judgment in this fight against the pandemic. Thank you very much, and next week we will be back with another COVID-19 weekly briefing. I am Les Roy Williams.